error code from your mobile phone. Okay, 3 of you answered it right. So the first question appeared in the advanced 180 exam is about the most common cause of loss of vision or blindness in the onchocerciasis. This question also appeared in the advanced 115 and we discussed it the last week. So let us repeat it for those who didn't attend the last course. The onchocerciasis, or it's called the Rift Valley fever, or the river blindness fever. This disease is one of the causes of blindness in the developing countries, and it was the WHO created some plans to eradicate it, and it was very successful. So this disease is characterized by invasion of the ocular tissue by the onchocercia volvulus. However, the actual damage that happened with the onchocercia volvulus is not due to the actual invasion, but it is due to the body response. As the body response by immune mechanism will cause killing of this onchocercia volvulus, inducing severe inflammatory reaction. So there will be severe inflammation of the cornea or keratopathy, but actually, and this will be the commonest cause of blindness or loss of vision. However, it is not exposure keratopathy, as exposure keratopathy is caused by like inability to close the eyelids, like in facial palsy or leg ophthalmos, causing corneal exposure. The second thing, or the maculopathy, actually the onchocercia does not involve the macula. It will be actually the chorioretinitis, which happen in the onchocerciasis, are sparing to the macula. Again, the optic disc can be also involved by optic disc edema or optic swelling, but not optic neuritis. So optic neuritis does not occur. However, the most common cause of blindness of onchocerciasis based on the current options will be the secondary glaucoma from inflammation, as the inflammation will cause severe uveitis, either anterior or posterior, which can cause secondary glaucoma and optic atrophy. So this will be the commonest cause among these reasons. So what happens after we discuss the question? We see who got it right. So we got Dr. Shabnam, Dr. Omar, Dr. Amanda got it right, and these scores correspond to their speed of the right answer. And whenever you have 0, then this means that you didn't score at this question. And we can present some slides to explain the questions. So onchocercia volvulus and the eye. There is destructive inflammation caused by the onchocercia infection, which is stimulated by antigen released by the dead and dying organisms. So actually the problem here is the dying or the dead organism itself, not the living one. There will be host immune response in the form of eosinophil and neutrophil infiltration into the corneal stroma, which will eventually result in corneal opacification. On the other hand, the severe inflammation will lead to uveitis, causing choroidopia, synechiae, occluding the pupil and secondary glaucoma. The fundus is also involved, but there is chorioretinal lesions that are usually asymmetrical lesions. They are peripheral to the macula and the optic nerve. So there is no maculopathy here. The peripapillary chorioretinitis with the optic nerve edema can result in optic atrophy. So actually there is no optic neuritis, but it is just optic nerve edema, which by mechanical effect can cause optic atrophy. And the chorioretinal lesions appear asymmetrical, peripheral to the macula or around the optic nerve. So this question has repeated in both advanced 115 and 180, and I hope that it is clear. You will find that most of the public health or community medicine questions have been discussed the last week, because almost more than 50% of these questions have repeated between the advanced 115 and advanced 180. So let's now move to the next question. And I think that you know how to play the game. And this is again a repeated question. Okay, 5 seconds. Okay, regarding the safe strategy in the trachoma, which contribute to decrease the prevalence. We have 4 options corresponds to the four strategies to decrease the prevalence of the trachoma. So it will be S and A and F and E. It will be S for surgery. This is surgery for entropion and trichiasis. A for antibiotics, F for facial cleanness, and E for environmental cleanness. So which one of these changes or these policies have been evolving or have evolved very rapidly in the last 2 decades? Will be the antibiotics. The question, the original question is saying specifically which one of these strategies show decrease the prevalence in the last 2 decades. So this was mentioned in the advanced 115, but it doesn't present here in the advanced 180, but we know it from the advanced 115 exam, that it is used for decrease the prevalence over the last 2 decades. So let me just edit. Okay, so why the A is the right answer? Let's see, first we got it right. Dr. Amanda jumped to the first place, followed by Dr. Shabnam, followed by Dr. Omar and Dr. Khulud. Dr. Sharif is still, I think that he is not around. So these are the 4 strategies for eradication of trachoma. It is surgery, antibiotics, facial cleanness, and environmental change. And all these measures can be used from many decades. However, the antibiotics specifically have been rapidly evolving over the last 2 decades, like those the azithromycin or Zithromax, like that of Pfizer. So I don't have any financial interest with that, but it's just like a slide I found to be illustrative for these strategies. But anyway, the antibiotics, those antibiotics shown to be very effective over the last 2 decades and shown to be very helpful, specifically over the recent period. Okay, let's now move to the next question. Okay, so when all of you answers, the counter will not finish to the end. So most of you got it right. And again, this is a repeated question from the advanced 115 regarding the diabetic retinopathy. Which region of the world is predicted to have the fastest growing incidence? Africa has shown to show the fastest increase in the prevalence of diabetic retinopathy. And this is why even the WHO is focusing its main concern on Africa, making many health promotion campaigns and trying to eradicate the blindness, because in Africa there is lack of health service that will be eventually increase the rate of blindness. And one of these reasons of blindness will be diabetic retinopathy. So we have here the same order of competitors, and you are all doing a great job. Let's see, this map will show the prevalence of diabetes over world and how much it will increase over time, starting from 2019 to 2045. And it will give you a clue about how is diabetes is evolving and how is its prevalence is increasing over time. So you can find in the North American and the Caribbean, it is 33% increase, while in the Europe, it's only 15% increase, Western Pacific, 31% increase, Southeast Asia, 74% increase, Middle East and North Africa, it is 96% increase. But look here, Africa is 143% increase. This means that the increase in the Africa, in the diabetic patients in the Africa will more than double. It will increase more than the double over the next 20 years. And speaking about the diabetic retinopathy specifically, there are some studies that evaluated the prevalence, the expected prevalence of diabetic retinopathy, like this study from the Diabetes Research and the Clinical Practice, which will show the global prevalence of diabetes, and it showed the same, almost the same figures, the prevalence over the different regions, with the Middle East and the North Africa will be the highest in the Africa at about 33.8%. So highest in Africa, meaning that the diabetic retinopathy will be in Africa, the maximum number or the highest increase over the world will be in the Africa. So again, we discussed this question last week, and let's see now. If you have any question as we go, please let me know in the chat box or just unmute yourself and speak in the mic. So this is a new question that didn't appear before, and let's see what will be the correct answer. Okay, great. So most of you got it right. Regarding the eye bank, so by eye bank we are talking about preservation of the eye or ocular structures. And what will be the ocular structures that are usually preserved in the eye bank? Usually the cornea and sclera. These are the ones that can be used for transplant later on for another potential candidate. So when we are preserving the tissues, we are using some storage media. These storage media we use them with some additions in order to preserve these tissues, like for example the antimicrobials, of which the antibacterial will be the most commonly used. The antifungal can be used in a specific occasion I will tell you about now, but it is not usually used. Actually, the usually used will be the antimicrobial. The whole globe can be stored. This is correct, and this was actually the first mode of preservation that was initiated like about more than 100 years ago, like in the 20th of the last centuries. The whole globe was stored initially. The idea of eye banking was started by whole globe preservation. We have two preservative media. One is called the cold storage, and the other is warm storage. And we will know the difference between both of them now, apart from the temperature, of course. But the warm storage will preserve more than the cold storage. We don't have the fourth option here, unfortunately, but we can still get the right answer from option B. Let's see who got it right. Dr. Omar is on the second place, and Dr. Sharif appeared that he was disconnected and joined again. So Dr. Amanda on the first place, and let's see and Dr. Shabnam on the third place. So let's see the explanation for this. We have two modes of preservation or two modes of harvesting the tissues. If we have a dead person and we want now to preserve the eye, we can just do simple enucleation. We take the whole globe and preserve it. And this method was used as a traditional method for many years in the last centuries. However, and let me tell you, while I was training on the corneal transplants in a specific country, we used to have this whole eye. So I had to use this whole eye to practice like posterior lamellar keratoplasty. So in order to practice posterior lamellar keratoplasty in a wet lab, you need to have an anterior chamber, and you cannot do that on just a corneal graft alone. So this eye, in order to do so, you have to do so on a whole globe, not only a corneoscleral button. And in this case, you can find that we can do enucleation and preserve the whole globe. And in this case, we can use the cornea, use the sclera, use any part of these tissues. However, in some countries, there are some legislations, like there are some ethical and religious and social considerations that maybe the relatives of the dead person don't want his eye to be all removed, so they just remove the corneoscleral button. They just remove the cornea and surrounded by like around 3 or 4 millimeters from the sclera, and preserve it in one of the tissue media or one of the storage media, most commonly the cold storage, like what's called optisol. So what are the different types of tissue culture media? We have what's called the cold storage and the warm storage. So cold storage, it is more commonly used, as it is technically easy to prepare. While the warm storage, it is less commonly used, as it is technically difficult. Actually, the warm storage is now, although it was invented in the USA, but however, it is no longer present in the US, and it is now it is limited part in the world, mainly in the West Europe, specifically in Spain. So they are still adopting this technique of storage in the current time. So why this is not too common, or why it is technically difficult, I will tell you now. In the cold storage, the storage media is like about it's about hypothermic storage solution. While in the warm storage, it's called warm because it will be stored in an organ culture. So what is the medium consist of? In the cold storage solution, there is a tissue culture medium, anything like that promote the tissue media, the tissue culture, like broth. I don't know what is the name of this medium, but it will be like a solution that will help the viability of the tissues. But it is a chemical, okay? It is supplemented with antibiotics and a detergent agent like dextran and the chondroitin sulfate. This detergent agent will help to prevent corneal swelling and corneal edema. So it is just very simple to prepare this medium. However, in the warm storage, the corneas are stored in an incubator. The cornea will be in an incubator, not in the refrigerator like in the cold storage, because the cornea will be stored at about 30 to 37 Celsius, which is like more than the room temperature, in a tissue culture medium, which is supplemented with fetal or newborn cough serum. That is why it's called organ culture, because we supplement this warm storage by a serum from a fetus, or of course stillborn or a dead fetus, or a newborn cough serum, and antibiotics. And of course, since that this is all organic material, we need to supplement it with antimycotics or antifungals. But since that the question is saying what is usually used, this is not usually the used method. So as you can see here, it is technically difficult and require more facilities. That's why it is present in the Europe, not present in like developing countries or so. The cold storage is about 2 to 6 Celsius, while the warm storage is between 30 to 37 Celsius. And the main difference between both of them is the storage duration. Like in the cold storage, it can be stored up to 10 days, up to 2 weeks. So 2 weeks will be the maximum for the cold storage. And so when you are doing a corneal graft, you should look at the date of death, and you should subtract how much days since that it was imported. If you don't have iBank in your country, you should check how many days elapsed between the death and you took or you received this tissue, and so you know what is your window in order to use this tissue medium. While the warm storage, since it is present in the incubator, which will give it more advantage of more longer duration or more viability in the incubator, so it can stay for 4 to 5 weeks. And to be honest with you, the graft clarity and it will be much better with warm storage than the cold storage. That's why some countries still in Europe prefer it, because it can be preserved for a longer time and it will be better for the graft itself. So as we mentioned, due to all these reasons, the cold storage will be more common because it's technically easy, while the warm storage will be less common because it is technically difficult. So you can see here, this is the difference between the cold storage. This is the cornea present in the solution that consists of detergents and antimicrobials and tissue culture medium, while these are the warm organ culture, which is present, the corneal grafts present with tissue culture medium and fetal serum or cuff serum, together with antimicrobials and antibacterial and antimycotic. So I hope that this is clear about everything about this question. And let's now move to the next question.